Magandang araw sa ating mga kababayan. Ako po si Dial Rodriguez.
At ako naman si Carmel Sapo. Kami ang inyong tagapagbalita.
At ito ang BPSB, Balita para sa Bayan.
Balitang tapat, totoo at mapagkakatiwala.
Laganap pa rin ang pagtaas ng kaso at bilang ng COVID-19 cases araw-araw sa ating bansa.
Tama ka, partner. At kasama dito ang muling paghihigpit ng mga iilang lugar sa bansa. Nakatutok si Anika Salong.
Muli na namang nagsagawa ng lockdown sa mga iilang lugar sa bansa upang mapabagal ang pagkalat ng COVID-19 cases. Kabilang dito ang Metro Manila, mga ilang barangay sa Caloocan City, Muntinlupa City, Quezon City at Pasay City. Sa ngayon ay kinakailangan pang manatili sa mga kanya-kanyang tirahan. Anika Salunga, nakatutok.
Maraming salamat, Anika Salonga.
At para sa kaligtasan ng lahat, narito ang mga payo mula sa isang health group sa United Kingdom.
The DOH has announced how to help avoid state virus, and there are a lot of personal safety practices that we can do to avoid getting them.
That is right, Liza. A few of my acquaintances have unfortunately experienced this. With the virus overtaking many countries, our country is not excluded. The government has conducted its first community quarantine in March to control the spreading of the virus. But with over 9,000 cases,
the DOH has announced how to help avoid state virus, and there are a lot of personal safety practices that we can do to avoid getting the virus. Charm, Dai, and CJ will explain this to you.
Every individual can help to prevent and stop the spread of coronavirus if we will follow the rules and guidelines that as implemented by the government, health organization, and World Health Organization. So these are the health and safety protocols that we need to follow. Physical social distancing. Maintaining the space between yourself and to others is the best personal safety practice. This is required and we need to stay at least 6 feet apart. Maintain social distancing whenever possible because some people can spread the virus without being sick or symptomatic, as well as stay out to crowded places and avoid mass gathering.
Stay at home always, but if you can avoid going outside, make sure to wear face coverings such as masks and facial shields. Make sure that it is properly covering your mouth and nose. Dispose your face mask properly and make sure to remove it by holding it into the straps without touching the front of the mask. Then immediately wash your hands.
Avoid touching your eyes, nose, and mouth. Be mindful and monitor your health. Be aware of the symptoms of COVID-19 such as fever, cough, shortness of breath, and loss of smell and taste.
Hand washing is one of the most important actions of individuals, especially in the days of pandemic, to prevent the spread of COVID-19.
Haner?
Si Manda?
Ano? Ha?
No! Ay, magtalo ka!
Ano? Bakit? Haner? Haner? Namiss mo ba ako?
Bakit ang may lalo?
May number 2 ka.
Wala, Han. Wala akong number 2.
Number 2?
Oo. Saan yung sinasabi mong number 2?
Sorry, Han. Talong number 2 sa number 1.
So what are the correct hand washing techniques? First, you need to wet your hands. Apply an average or pea-sized amount of hand wash or soap. Rub hands together. Make sure to scrub between fingers, nails, and wrists. Take at least 20 seconds in rubbing your hands. After taking at least 20 seconds in rubbing your hands, rinse the soap completely with running waters. And lastly, dry your hands with clean tissue or cloth.
Whenever you sneeze or cough, make sure to cover your mouth and nose with a tissue and throw them away in the trash. And immediately wash your hands with water and soap, or use a hand sanitizer that at least containing 60% of alcohol. If you do have a tissue, it is recommended to sneeze and cough inside your elbows and not in your hands.
Clean and disinfect the things or surfaces around you, including tables, doorknobs, light switches, handles, desks, phones, toilets, faucets, and sinks. For clothes, detergent or soap and water is prior to disinfection.
With everything that is happening, it is important for us to be alert in everything we do and to be responsible, because our actions have consequences that may not be only for us, but will also affect other people. If we do not mind our actions, we might pass the virus without knowing it.
And let us be fair with everyone trying to protect their family, so always be cautious. Let us help and protect each other in this pandemic by disciplining ourselves and uniting as one. This is cliche but relevant. Prevention is better than cure, and pain from discipline is better than pain from regret.
Thank you very much! At para naman sa ating chika-chika, Eliza, i-chika mo na yan!
Naku, tamang-tama, Charnil. Ngayong pandemya, marami ang naapektuhan. Dahil sa mga ito ang mga homeless people o walang matirahan. Sila ang ilan sa mga prone na makakuha ng virus. Kaya naman sila ay lalong nahihirapan ngayong pandemya. Ngunit sa kabila nito ay meron naman mabubuting loob na handang tumulong upang masolusyonan at matulungan ang mga ito. Balik sa iyo, Charnil.
Salamat sa iyong chika, Eliza. At yan ang mga balita ngayong linggo.
Muli, ako po si Dial Rodriguez.
At ako naman si Charmel Sagong, nagbabalik.
At ito ang BPSB, Balita para sa Bayan.
Balitang tapat, totoo at mapagkakatiwala.